I'm Jane Williams. This is the Red Eye Podcast. You can hear our live broadcast on Saturday mornings from 10 till noon at 100.5 FM in the Lower Mainland. Today I talk with Dr. Michael Kobor of UBC about how the COVID-19 pandemic may affect children's long-term health and development. One fortunate aspect of the COVID-19 pandemic is that children have been less directly affected by the disease. But despite the relatively low incidence of severe illness in children, the response to the pandemic may have long-term adverse effects on the health and well-being of children and adolescents. Dr. Michael Kobor is one of the authors of a recent article on The Conversation about the impact of increased stressors on children and adolescents. Dr. Kobor is Canada Research Chair in Social Epigenetics and Professor in the UBC Department of Medical Genetics. He leads the UBC Social Exposome Research Cluster, an interdisciplinary effort spanning 8 faculties that investigates the health effects of social and environmental factors. Dr. Kobor's own research program aims to understand the biological mechanisms by which social factors get under the skin to influence child health and development. And Dr. Kobor joins me today. Hello, Michael.
Hello, Jane. Thanks for having me on the show.
It's my pleasure. What are some of the stressors that kids are experiencing right now?
Well, I think, there are a number of them. The ones that we feel most strongly about in terms of potentially having a long-lasting impact on child health are things like reduced family income, food insecurity, parental stress, and all the way to child abuse.
And I guess that there will be a differential effect on children depending on their economic status, whether they come from racialized families or not, a whole bunch of different factors.
Oh, absolutely, Jane. And I think, this is very early days and the kind of questions that you just raised are crucial for us to inform and better understand what really is going on under the skin across children in BC and in Canada. That being said, I'm fairly confident, sadly, that it's particularly the children in the families that are already disadvantaged or racialized that might be more at risk for the kind of situations that we describe in this paper.
What is the impact of first the school closures and then the loss of other typical kind of activities like sports, like summer camp, that kind of thing?
Well, again, Jane, I think there is, a whole spectrum of potential impacts. One of them, as we know, many of our children actually rely on the schools to get a nutritious meal. They rely on the schools to provide a certain kind of routine, which we know is so important for proper child development. As they get older, there is also the potential positive impact on peer interactions that might be missing with the schools being closed. So again, there is a spectrum that I think we need to look at.
I guess there's also a spectrum according to what age children are.
Yes, absolutely. And again, there is the idea that the pandemic might have perhaps different impact on whether we look at rather young children versus adolescents. And again, these might be different and depending also on the family status and where these children are in their own development, we might see different impact. But again, I think there's evidence that for all of those, they could be potentially getting under the skin and last for a long time.
Well, let's talk about that getting under the skin idea. How do stressors stemming from the pandemic become biologically imprinted in children?
It's a great question that many of us spend, our entire careers trying to figure out. And certainly some of the concepts that have emerged over the last 10 to 20 years were really born here right in British Columbia by my mentor, the late Clyde Hertzman, who really came up with this idea that there is a biological embedding of early life experiences in particular. And we know, while the exact mechanisms remain to be really deciphered in many ways and interrogated, we already know that these early life environments, and especially the harsh ones that we talked about, they can become biologically embedded and negatively impact the developing brain of our children, their immune systems, and ultimately their ability to thrive.
Now, in your article, you said that that epigenetics is particularly well studied. Can you explain for me what epigenetics is?
Sure, and it's epigenetics is my favorite topic. That's what I've been doing for the last 20 years. Epigenetics is essentially studying light bulbs. If you imagine that all our genes, every single one of our genes, so we have roughly 25,000 genes, all of us humans, that every gene is a light bulb, you can imagine that the light bulb can be either totally on or totally off. But if you live in a fancy house, you might have a dimmer that can put that light bulb, the intensity anywhere in between. And really, the epigenetics is the dimmer that sets the intensity of the light bulb. In other words, the activity of our genes. And the really fascinating thing, Jane, that I just wake up every morning just marveling about is that it's shown that the environment, social environments, physical environments, they can slightly tweak that dimmer and set these light bulbs at a different intensity. And especially if these environments happen to get under the skin early in life.
So give me an example of how that would work.
So one example that we have been studying in collaboration with folks in psychology, the impact of early life poverty. So in children growing up in low socioeconomic status, we have shown that this can impact their dimmer switches, their epigenetic patterns. And by doing so, it can impact the functioning of their immune system. And this can last all the way into adulthood and having adverse effects on, say, cardiometabolic health, mental health, and the like.
So in this current situation, your concern would be that children would be experiencing such a range of stressors that you could see really major impacts over the next 30, 40 years in population health?
That is one of our worries, Jane, and certainly, we know from past situations, past things that happened when you take, the Quebec ice storm, for example, a natural event, or 9/11 and other things where, there are fairly sudden and dramatic shifts in the environment. I think what really sets this apart is that this shift is so broad and touching so many families across our society. And it's so multifaceted because you have, in many cases, you have the issues with, loss of employment, translating into stress. You have the absence of the regular school environment that we discussed earlier. And so we feel that there's really sort of almost like a double whammy of potentially adverse events that our children are experiencing as we go through this pandemic.
So what could protect Canadian children in this environment?
Well, I think there are a number of things that, again, we know from different studies that are not directly based on the pandemic, but relate to related situations that, for example, the presence of supportive parents, of supportive communities, of supportive caretakers, whether it's in sports or in the school, can help. I think having the opportunity for children to feel as safe as possible will provide a buffering effect. We know that the presence of warm and supportive adults does actually translate into buffering up of some of the detrimental effects that we discussed a little earlier about the early life poverty, for example, and on the immune system.
So it's starting to sound like going back to school for kids is one of the best things that could happen. Could I say that?
That depends again from the lens you put on. I think I'm the last person to say we should send our kids back to school if it's not safe and healthy for all involved, including teachers and parents. But certainly from the aspects of these sort of unintended consequences that might negatively impact on child health, loss of the sort of routines that come with school. And for many children, the loss of a nutritious meal that they get in school. I think from that aspect, certainly having some exposure and some opportunity to come back into their routine environment, that being the school, would be beneficial.
In the article, you say that Canada is failing to prioritize the basic needs of children and adolescents in reopening plans. How so?
Well, I think, and this article was written a while ago, so perhaps it's slightly changing, but certainly in the early days, and probably rightfully so, we didn't hear much about the impact that the pandemic and the policies and the social change that went along with the pandemic had on the children. We mostly heard about the adults that were, getting sick and the like for all the right reasons. But as the situation evolves and these potential environments that we have identified kept going on, I think it's crucial that we bring children back into the conversation because of these potential long-term effects and the dramatic impact that they might have, as you mentioned earlier, Jane, on population health, not just now, but for years to come.
So what would you like to see happening at a policy level?
Well, I'd like to see a number of things. Then there is. I'm very pleased that I hear conversations now including children, mostly in relationship to schools, but also perhaps in the sort of more longer-term impact that we're advocating to be part of the conversation. I think there are certainly groups both at the local level. I'm thinking of, for example, Basics for Health and First Call BC that are raising this with the BC policymakers at the federal level. There's organizations like Children First Canada that have written opinion pieces and then letters to Parliament to raise this issue. So I think people are advocating for our children and are bringing this to the forefront. Personally, I think having the opportunity for folks that understand child development and that understand the lasting impact of environments on child and ultimately adult health should be an important part of these conversations being around the table.
Well, thanks so much for talking to me today, Michael. It's been really interesting talking to you.
Yeah, thanks so much. And then I just want to sort of maybe close, if you don't mind, with a quote from my favorite BC champion for children, that being the late Clyde Hertzman, who really his favorite saying was, "It doesn't have to be this way." And I think we're really at a point where collectively can ensure that we avoid the worst of these effects for our children if we all pull in the right direction.
Thank you very much.
Thank you, Jen.
I've been speaking with Dr. Michael Kobor, Canada Research Chair in Social Epigenetics and Professor in the UBC Department of Medical Genetics. He's one of the authors of an article on the long-term biological effects of COVID-19 stress on kids' future health and development, published on The Conversation on July 12th. The Red Eye podcast is produced at the studios of Vancouver Co-op Radio. You can support us by supporting Co-op Radio. Go to coopradio.org and click on the donate button. Independent media relies on the support of people like you.